chat box. If anyone has not got, so I'll share again. Okay, so I am going to read the case, right? Because at least we have to read it 2 or 3 times before we start doing the case. So your role is doctor in medical ward, and regarding this patient, Alfred Robbins, 94-year-old. He is a 94-year-old male, bedbound since 5 years after a massive stroke. In addition to this, having uncontrolled type 2 diabetes and ischemic heart disease 10 years back, and suffering from vascular dementia. Admitted in medical unit 5 days back and started on nebulizers, IV fluids, and antibiotics. On ward round today, it was noticed that he is not making any progress and still remains confused. So medical team has decided to sign a DNR form for him, and your task is to speak to his granddaughter, Miss Lisa, update her about this DNR decision and address any concern she has. So I think we can start now. Uh,
Hello.
yes, yes.
Hello,
So
sir.
should we? Yeah, should I set your timer?
Yes, doctor.
Right. Okay. Yes.
Hello. My name is Dr. Rabi. I'm the doctor in this medical ward. May I confirm if this is Miss Lisa, next of kin of Mr. Alfred Robbins, 94 years of age?
Yes, doctor. I am.
Okay. How may I address you today, Miss?
Lisa is fine.
Okay, Lisa. So we are here to discuss about your grandfather's health. Will that be okay with you?
That is fine, doctor.
All right. So, is there anyone that you would like to be in this conversation with us?
No, no, doctor. It's fine.
All right. So, before I begin, Lisa, I just want to know some brief overview about the understanding that you have regarding your grandfather.
Yes, doctor. My grandfather actually, he had a stroke a few years back, and he was bedbound because of it. And he's known to have high blood sugar, high blood pressure, and now recently he had some shortness of breath and cough. So we brought him here, and I think I just want to know about him now.
You're very right, Lisa, and I thank you for sharing the information. And yes, your grandfather, as you mentioned very correctly, that he has a lot of illnesses in the past, like you mentioned, high blood sugar, heart disease, and problem with the memories, right?
Yes, yes, doctor. That's right.
Yeah. And as you said, he's been here in the hospital for past 5 days. We have started him some medication, but however, unfortunately, we haven't seen any progress in his recovery. I'm really sorry to say this, Miss Lisa.
Oh my God, doctor. So what you? So please do anything. Do for him something, doctor. I cannot see him like this. Please help him.
Yes, Miss Lisa, you're very right. I know you are very worried about your grandfather, and I understand that you want him to recover, but considering his age as well as his, old diseases, it's very, the chances of his recovery is very grim, very less, okay? And our medical team has reviewed him, and unfortunately, I'm really sorry to say that, but we do not see, any signs of improvement, and our team has decided, you know a different mode of treatment for him, okay, which is called, end of life care. Have you ever heard this term before?
No, no, doctor. What is that?
So Lisa, when the patients, when the medical team sees, there are very less chance of recovery from his illness, then we start them on different mode of treatment, uh, with no intention to cure his disease, but rather to make him more
Oh my God,
comfortable.
doctor, why would you say that that you have no intention to cure him? Why, doctor? Is it because he's too old? Is this why you are doing that?
Miss Lisa, I appreciate your concern. I mean that, the chances of recovering him from his old disease is very, very less. And even with our best effort, we do not see any recovery on him. And in top of that, whatever we do, the procedure, the medication, the lines, it's all going to add a suffering to your grandfather. And I'm really sorry to say that.
Oh my God, doctor. So, doctor, and please do for him something that he recovers.
Yes.
Please don't give up on him.
Mm, Lisa, I'm sorry if you think that way, but however, we are doing everything we can make your father, make your grandfather comfortable. We are not giving up on him. Okay, your grandfather is our priority. Okay, and we will make sure he will stay comfortable. But however, as I said, so considering his old illnesses, um, our medical team has decided to uh, start him on this treatment. Okay, which will make sure that your grandfather stays comfortable and stays pain free. Are you following me?
Yes, doctor. It's really difficult for me to hear that. But please, doctor, do everything you can.
Yes, yes, Lisa.
Don't do that for him. I want you to do everything for him.
Yes,
Don't.
yes,
Yeah, yes, doctor. Don't withdraw any treatment. I really want you to continue all treatment for him.
yes, Miss Lisa. And there is one important thing that I need to discuss with you.
Yes, doctor.
Shall I discuss it with you?
Yes, doctor.
So, Miss Lisa, has your grandfather mentioned any wishes that he would want us to respect regarding the further, regarding a time when he cannot decide for himself, or any treatment plans that he have mentioned to you?
Um, no, doctor. But yeah, I know he always wanted to live. So I'm really not happy with your decision. I want you to do everything for him to bring him back, and I want you to do every intervention. So please don't take this decision for him, doctor.
Yes, Lisa, I completely understand, and I know that you want the best for your father, and we want the same. Okay, our team has decided to do in his best interest. Okay,
So,
and
doctor, does it
yeah.
mean you are going to stop all the treatment for him which he is receiving?
So we will give him the treatment that he needs. Okay. However, I want to discuss this thing to you. Like, in the time when, you know, when he's doing really poorly, when his heart stopped, okay, what we do is uh we perform a treatment called restarting the heart. Okay. CPR. Have you ever heard this term before?
Oh, yes, doctor. Yeah, I think I have heard in which they give some chest compressions and all.
Yes, that's very right. Yeah. So we think, the outcome, the chances of recovery in case if your grandfather, heart stops is very, very less. And the outcome is very, very poor. And it's only going to add, suffering and pain to your grandfather.
Doctor,
Okay?
I think you are doing this because of his age. I think you should do this everything for him.
Yeah.
What does it mean if his heart stops beating, or if he like you would just stand on a corner and just let him die? Does it mean
No,
that?
no, no, no. That's not what I'm referring, Miss Lisa. What I meant to say to you is, in
Two
case if
minutes
you
left.
in case of your grandfather's heart stop, okay, even we are
So,
able to
doctor, this
restart.
is what you mean that if his heart stops, for the rest of the people, you will give them CPR, you will give them everything. But in
Yeah.
case of my grandfather, you will just stand and see him die. You will not do anything for him.
No, no, that's not what I mean. I'm sorry if you understood that way, but I did not mean that, Miss Lisa. What I was referring is even his heart starts, okay? When when at a time when the heart stops beating, there are some chances that he had some damages in the brain, okay? And these things may lead very poor outcome, like maybe he may not be able to move his arms, he may not be able to recognize people, he may have some weakness, and what I'm telling you, it's all gonna add suffering and pain to your grandfather.
Doctor, so how long does he have?
I'm really sorry, Miss Lisa, I cannot exactly say how long does he have, okay? But in this time, we are going to take care of your grandfather as much as we can. We will make sure that he stays comfortable and pain free. Okay. Okay.
Okay, okay, doctor.
It's so to predict the time is very difficult for us. Okay, Miss Lisa. And may I ask if you have any support at home? Anybody else is taking care of your grandfather?
Uh, no, no, doctor. Just it's me and yeah, my other sister. Yes, we take care of him.
Okay. And um, may I ask if you require any offer, any help at home?
Yes, doctor, that will be helpful. Doctor, can I call my other family members to see him? And are you going to discharge him now?
Um, mm, so at the moment, he will be here with us. Okay, you can call your family
Mhm.
member. Yeah,
Mm. Yeah, you can answer her quickly. Yeah.
yeah, you can call your family members, and yeah, maybe they can have some time with him.
Mm,
Right?
right. So sorry, time is up. Right. So yeah, actually, you did quite well. And if same you do in exam, so I think there is no reason to cut any marks. Just few things. We'll see how we can do it bit better, and few of the concerns how we can answer them bit better. But if same you do in exam, then I think you can manage to get full marks. Right, so we will discuss it. Just few concerns I'll tell you, they could have been answered better. A few more small details were missed, I'll tell you which we can add. Other than that, it was a good performance overall, right? So those who have joined now, I'm sharing the scenario again, right? Because I'm just sharing it again because it's very important read it carefully before we start any communication scenario. So I've shared the scenario again, those who have joined now. So this scenario has been appearing very frequently in this this DNR scenario, but it was appearing in other contexts, like in the context of breast cancer with mets, but it was all same. Right, it's all same. So this is the scenario where we have to sit with the relative and tell about this
Gamba no macha alaga.
uh, okay, so we'll have to mute everyone. Okay, let me mute everyone. Okay, so yeah, so here in this scenario, so this is a scenario where we have to talk about this DNR decision. Now, the first question is when we have to bring up this topic of DNR, do not attempt resuscitation, when we have to bring up this. So, answer is whenever and only when it is clearly mentioned in the scenario. Only in those cases we have to bring this up, right? Why? Because this is a very sensitive topic and it is a medical team's decision, so we cannot just randomly go and talk about it, right, unless the medical team has not decided about it. right? Then how are we going to do this? The way Dr. Abhi did, he did it quite nicely. Like usually how we will do it, we have to first paint very poor background of multiple health issues, and how resuscitation would not be successful, and if at all it is successful, then it will lead to very poor quality of life. Like for example, when the heart has stopped beating, then it will cause hypoxia, brain injury, that can lead to permanent disability, or it will, because they have so many comorbidities and all. So if even if it is successful, and it like saves the life, so prolonging the life means prolonging the suffering. So we will first paint very poor background, then we will tell them that how even if at all it is successful, then it will just prolong his suffering. It would lead to very poor quality of life. Like for example, during CPR we give this chest compressions and all, it can cause fractures and all. So like even if it is successful, it will cause poor quality of life. And in order for this to be successful, our organs, the heart and lungs, the major organs, they need to be in good health, right? So we will explain them. And also in this sort of scenario, when the patient is confused, right, or so here they don't have autonomy. Anyone who is confused don't have autonomy. So how we respect their autonomy? We ask them about their advance directive, we ask them about their lasting power of attorney and about the wishes. But be careful in every scenario where the patient is confused. We don't have to ask about advance directive, LPA. Like for example, someone, there is a young female, she had pulmonary embolism, like she was pregnant and she had developed pulmonary embolism. Now she is confused. So here we will not ask about advance directive and lasting power of attorney. Why? Because she is young, she was pregnant, she has recently delivered. This means she wanted to live, right? So or someone had an accident, had brain hemorrhage and all. So in such scenarios, we will not ask about advanced directive, lasting power of attorney. But in most of other scenarios, like where there has been gradual deterioration and old age and all, there we have to ask about advanced directive, lasting power of attorney, and their wishes. Now, and Dr. Abhi, one more question. What if this lady, this Miss Lisa, she refused to go for this DNR decision? So will you still go for it or you will not?
Because she doesn't has lasting power of attorney, so we will respect the medical team decision.
Hmm. Right, right, right. And even, yeah, if they have lasting power of attorney, in that case also, like we will go to court. Like in that case also, because the people who are confused and their medical team decides in their best interest. So purpose of discussion with the relatives is only to avoid conflict. Because later, if they discover that this decision was made, but they were not told, like they might not feel good about it. So it's just to keep everyone on the same page. The purpose is not to take permission, because I have been doing these cases with some candidates also. So sometimes they are confused, right? So here the purpose of talking about DNR is not to take permission or anything, just so that we are all on same page, right? And so how we will do this scenario? Yeah, so we'll introduce ourselves. So, hello, I'm Dr. Aisha. I'm one of the doctors in medical ward. And then usually we say good morning, we say this nice to meet you and all. But in communication scenarios, we are usually going to break a bad news, usually in most of the cases, or like such sort of things. So, usually it's better not to say any of that, right? So, hello, I'm Dr. Aisha, one of the doctors in the medical ward. Can I confirm that you are Miss Lisa? And can I confirm that you are granddaughter of Mr. Roberts? And can I confirm that you are the next of kin? Right? And if the patient is not confused, the patient is conscious, then we have to also ask that I hope your grandfather, or I have taken permission from your grandfather, and he's okay, or he's happy for me to talk to you about his health condition, in case they are not confused. But here he was confused. In this scenario, we get that he is confused. So we will just ask that, are you the next of kin? By asking that, we have shown that we are careful about the confidentiality. Then we have to set the agenda. So this agenda setting is usually constant. Just according to the task, we modify it a little bit. So we are here to talk about your grandfather's health condition, our further management plan, and to address any concerns you have. Is it okay? Okay. So before I start, so that we are both on the same page, can I ask how much you know about your grandfather's condition? And then after she tells us all, then we'll paint very poor picture of his condition, that we reviewed his condition today, and I am very sorry that your grandfather, he's not doing very well. He had all these issues, and on top of that, he had this chest infection, and he's still drowsy, and he's not doing well. Then we will invite her opinion, that like, have you had any thoughts about, or are you aware of any of the wishes of your grandfather, that how he would like to be treated in situations such as this? Like, at this point we can ask about advance directive and lasting power of attorney. If he had any of the documents refusing from a specific sort of treatment in case he becomes unable to do so, what we call as advance directive. And for lasting power of attorney, this also we have to ask that, has he nominated anyone on his behalf to take decisions for him in case he becomes unable to do so, what we call as lasting power of attorney. So it is good to bring it at this point, because for example, here we ask them about advance directive LPA, and they already tell us that yes, it was his wish that he should not be given CPR and all that. So this will make our case very easy, right? So we can ask that here. Then we will tell them about the task, this that our medical team, they reviewed his condition, and he's not doing very well, and he's not improving. So we made the medical team made the decision in his best interest, that in case his condition deteriorates further and his heart stops beating on its own, we will not proceed for a resuscitation, or we'll adopt a DNR care decision pathway. Have you ever heard of that? Or what you know about it? Then we will explain her. So, usually, what happens if someone's heart stops beating on its own, we do a procedure, what we call as CPR, which involves giving chest compressions, oxygen, and medications through blood channels till our heart and lungs regain the normal function. But in order for this resuscitation to be successful, the major organs like heart and lungs, they should be in good health. And I'm really sorry to tell that this is not the case in your grandfather. And even if at all it becomes successful, then it would lead to very poor quality of life, and it would just prolong his suffering. So that is why, in his best interest, our medical team has decided to go for this. Then tell her that it does not mean that he will not receive other treatment. He will keep receiving all the treatment to keep him as comfortable as possible, and like, he will receive all the medicines, he will receive all the nursing care. And if at any time you feel that he's not receiving this basic care, you can come to us, or to any of our medical team immediately, and we will address that, right? And then also tell her that this decision is not final. We will keep reviewing it on regular basis, and if he starts Yeah, so there was no voice in between. Anyone can tell me till where you have heard or till where we have done, so that we
Ma'am, there
can.
is no voice for last 45 seconds. You can
Uh,
continue for, yeah.
right. So till now, what we have discussed, it is clear because it seems simple, simple things, but this is appearing every other day. DNR this coming every other day. So like we should prepare it, right? Is it clear till now? We have done till now what we discussed. Is that clear? So what have
Yeah,
I?
up to, yeah, up
Yeah.
to this point is clear. Now you can continue. Yeah.
Right, right. So, what we did till now, we do this agenda setting and all. We paint very poor backgrounds. That is, you see, your grandfather, he has all this situation, all these health problems, and on top of that, he has also got this chest infection. And then we reviewed his condition. We gave him all best treatment. We reviewed his condition, and still his condition is not improving. So our medical team, in his best interest, has decided that in case his heart stops beating on its own, we will not proceed for a CPR, or what we call as resuscitation. Have you ever heard of this, or what you know about it? And then we will explain them little bit about CPR, that what happens if someone's heart stops beating on its own. We do this procedure we call as CPR, which involves giving chest compressions, oxygen, medicines through blood channel till our heart and lungs regain normal function. But in order for this resuscitation to be successful, the major organs like heart and lungs, they should be in good health. And I'm really sorry to tell that this is not the case in your grandfather. And even if it is successful, then it will lead to very poor quality of life, and it would just prolong his suffering. That is why our medical team, in his best interest, we have decided to go for this. Then tell him that by this decision, let us admit everyone. um, yeah, then tell them that by this decision, it does not mean that he will not receive other medical treatments. He will receive all the treatment to keep him as comfortable as possible. He will continue to receive medicines, nursing care. And if at any point you feel that he is not receiving this basic care, you can come to me or to any of our team members immediately, and we will address that, and we will sort that out. And then also tell him that this decision is not final. We keep reviewing it on regular basis, and if he starts making improvement, the decision can be reversed also. Right, tell them this, and then show a lot of sympathy, empathy. I am sorry, it's very difficult, hard time for you. I can only imagine how hard it is to hear all this, but be assured that all our medical team, we are here with you and your grandfather to give him best possible care and to keep him as comfortable as possible. Now, some of the common concerns, whatever is the background or all in this sort of scenario, some of common concerns that yeah, are you doing this because of his age? I'm sorry if it sounds like this, but we don't differentiate or anyone based on the age, right? We are just doing it in his best interest to keep him as comfortable as possible. And then how long does he have? So this means here we have to give some answer, right? But of course we cannot tell exactly how many days and all, so we can give them rough estimate that his condition is quite serious, and it's not improving, and I'm afraid we are talking in a matter of days or weeks rather than months or years. Like we have to answer, we cannot ignore the concern, right? And can I what was other concern? Yeah, can I call my other family members to see him? So yes, you can call, because this is not any infective disease or anything like COVID or any respiratory sort of droplet infection, or so yes, they can call other family members to see. and will you stop all the treatment she is receiving or he is receiving? So again, here we will clarify that no. So I think that now anyone wants to add or ask anything?
Yes, doctor.
Yes, please.
Should in this situation, should we ask about like his quality of life before the admission, and how we can address this issue?
Yes. His pre-morbid state and all this we can ask. But actually, from scenario also we are getting a lot of information that he has been bed bound and all. From scenario also we are getting information. If there is not much information from in scenario, then yes we can ask. But actually, in the end we have to stick to the scenario and we have to defend. If the consultant has said DNR, we have to stick to DNR irrespective of his pre-morbid condition and all, right? And we will have to defend and we will tell points to defend that. But okay, if we ask few things to add to our when we are trying to convince him, we can, no problem.
Ma'am, I have a question.
Yes, please.
Okay.
Doctor, yeah.
Yeah.
There was no any chest infection mentioned in the case. So should we bring up in while doing the case?
Yes. Chest infection. Yes. We will first tell that he had this stroke, like this weakness, high blood pressure, high blood sugar. Now on top of that, he has also had this chest infection, and we
We
have
did not.
given him
No,
all
in the
the
case.
medicines.
No, in the
Yes.
case there is no chest infection mentioned. There you have just mentioned about medical treatment 5 days back and started on nebulizer, IV fluids, and antibiotics. So my question is, should we assume it's a chest infection or not? Because it is not given in the scenario.
Oh, okay. I'll read the scenario again. Okay. If it's not mentioned, then we can ask them how much you know, and then she told that he had this cough, shortness of breath. Then we can say, okay, for his symptoms, we started him on this medicine, and despite all the adequate treatment, he's not improving. Just we have to stick to scenario. Actually, I think I have missed a few words in typing. Yeah.
Doctor, should we also mention about this hospital chaplain and bereavement
Uh,
services?
yeah, that is in case when we are declaring the news of death. Usually, like there are some this post-mortem and these scenarios there we can but in this scenario, yeah, if specific they want to have any other sort of support, we can usually like the type of scenarios we are doing, the post-mortem ones and there, so there we do mention about these bereavement services, hospital chaplain and all that.
Okay, doctor.
Okay, ma'am. And my question is, if the situation improves of your father or mother, in that case, we'll also continue the treatment. If the surrogate asks, okay, in that case, do you want to CPR or continue the CPR? If her or his heart stop, what should our answer? For right now, we'll not continue CPR, but in a situation where his situation improves, condition will improve. In that case, will you continue CPR on my mother case? If the question is like that, what should our answer?
Right. So we will see. For now, this is the decision which is in place, which we have explained. But this decision is not a final one, and we will keep reviewing her condition time to time. And yes, in case her condition improves, this decision might be reversed also. But again, this will be a medical team decision. But I'll keep you updated. Like if anything different is decided or if it is reversed or anything, I'll keep you updated.
Okay. Yeah. Thank you.
I have a question, Dr.
Yes,
Aisha.
please.
I just want to ask you, when we're talking about advanced directive, shall we use the word advanced directive with the patient, the relative?
No. We'll have to. Actually, yes. In communication, like they scare us a lot also that jargon and all. So, if in case we use a jargon, immediately explain it. Right? Most people know what is advanced directive, but if they don't know, then we can explain it. That has your grandfather written any specific document to has he had any legal document refusing from any specific sort of treatment in case he becomes unable to do so, what we call as advance directive. Right?
Okay. Okay. Yes.
If they
Yes.
understand, then also okay. But it's better to explain, because maybe if some examiners say jargon, then what we can do? So better to explain that did he write any specific document to refuse from a specific sort of treatment in case he becomes unable to do so, what we call as advance directive. And same for LPA, lasting for power of attorney. Has your grandfather nominated anyone on his behalf to take decisions for him in case he becomes unable to do so, what we call as lasting power of attorney. Right? Any other question?
Okay.
I have a
And
question.
Yes.
we'll mention about palliative care to them. Palliation. Shall we use the word palliation in this situation, or there's no need to mention about palliation?
No. I think just we stick to the scenario. Although what we are saying indirectly, it is palliation that we'll, but just I think we just stick to scenario. Already, time is also, this scenario is bit long. First we paint poor background, ask advanced directive, LPA, tell the decision is not final. It's already long, so better to stick to scenario only. If they ask us, then we may explain, but better to just we stick to scenario.
Okay. Thank you.
You're welcome. Yes, doctor. Okay, if no more questions, so we can end the session. Okay, let me see in the chat box if any questions or anything. Any specific, any specific frame for closure? Uh, actually, in the bad news and all, we don't have to summarize, right? So we will not summarize it from the beginning while we are closing. That your grandfather, we have taken this decision for him and all. We will not summarize, because in bad news, in error, in these type of scenario, if we summarize, they will be upset all over again. So we don't summarize. We can just show a lot of sympathy, empathy. I can appreciate how hard it is for you to hear all this, but be assured, our medical team here with you, with your grandfather, we'll give him best possible care. Like a lot of sympathy, empathy, and not reassurance, like a lot of sympathy, empathy, and tell her if at any point she thinks that his grandfather is not receiving adequate care and all, you can tell us. So like this, we can summarize or do the closure. Right. So I think if any
Ma'am,
other...
just last questions from my side,
Yes,
because
please.
in some scenario we have to mention some medical word. Okay, as long as we are just clarifying and just explaining the symptoms or the procedure in layman term, I think is okay. What's your what's your opinion in this guy?
A medical term, it is fine, but in case, like, practice in a way that we have this layman for every medical term, we have the layman equivalent. But in case sometimes we don't have, so no problem, just say it and then immediately explain that, or say what we call as in our terms, CPR, like anything. Okay,
CABG,
say
for
it, then
example, CABG, because to explain CABG, I have to explain number of terms during the explanation process or time. So every time I'm explaining or telling any medical term and followed by explanations I'm giving, is it okay? I'm just
so what example you give? CBC?
CABG. For example, CABG is a procedure where we'll make under general
Yes.
anesthesia. General anesthesia means AAA. I mean, every time I'm just uttering a medical term followed by giving explanations in a layman term. My question is, it is okay or just should I avoid
Yeah,
avoid it?
but still, I would suggest that try to use that as minimum as possible. Like I would suggest that, like general anesthesia, just we can say sedation, or try to use it layman as much as possible.
Okay.
Because if examiner say it's jargon, or they mark it like this, 2-3 jargon, and communication skill is gone. But if in case you use it, no problem. Immediately explain that what we mean by that.
Okay. Thank you.
You are welcome. Right. So I think we can end it here now. Thank you for joining.